Hormones are chemicals in your body that have multiple functions, including blood pressure, temperature. It talks with all the other hormones in your body, from your brain, from your skin, to your kidneys, to all the other organs, in order for it to work properly. Well, when we're born, like everything else, the hormone starts to increase as we develop, meaning that there's more cells that make up more organs, and the organs are the ones, or the glands, I should say, are the ones that secrete more hormones. By the time you reach puberty, 12 to 14 years of age, that's really the maximum hormones, and that's why we go through all the changes of puberty, the acne, the sex organs develop quicker, pubic hair, and that, all those type of characteristics is because of hormones. And as we go through life, they start, unfortunately, declining. By the time you're about 25 to 30, the hormone starts to decline slowly but surely. That's a very good question. That used to be the old school of thinking, that we start replacing hormones once a woman or a man reaches 50 or 60, menopause or andropause, respectively. But now we know, because of a new branch of medicine called wellness medicine, that since by the time we're reached in the 30s, excuse me, most people lose about 20 to 30% of the hormones. And there's a lot of side effects of losing the hormones. You know, they could include anything from anxiety to depression. You start losing bone quicker, especially in a woman, increased weight gain, your skin changes. And during that time, it's very wise to be proactive, to replace the hormones early on to prevent those significant changes once you hit perimenopause or menopause. The diseases that you could prevent by replacing or being proactive early on includes anything from Alzheimer's, Parkinson's, short-term memory, the strength or the systolic function of the heart, by burning calories, burning fat, and building muscle, that's testosterone, that is directly related to metabolic syndromes, meaning high cholesterol, diabetes, and blood pressure problems. It has been documented medically that if you have enough testosterone, you're less likely to get these metabolic syndromes. And especially for women, the osteoporosis or osteopenia is extremely important as we increase in age. But that is one of the main things that the hormone actually will also improve on. In the human body, by what's going on the periphery, meaning in the legs or in the arms, it gives you an idea what's going on centrally. For example, the flappiness or the lack of muscles in the arms, if you see the older women that they're able to flap their wings, that's an indication of very low skeletal muscle. Skeletal muscle is the muscle in the arms, but also the muscle that the heart is made of. And if this is very flabby, therefore the heart is very flabby, and that's normally secondary to low testosterone. There's a lot of medical studies proving that if you have low testosterone, there is a weakness of the heart. And if you ever have an elderly parent, family member, the doctor will tell you, well, her heart is weak. And that's really, they mean that her heart is weak by the time they reach 80, 90 years of age. And if the heart is too weak, it's unable to pump properly. So there's fluid in the lung. It's called CHF, congestive heart failure. So there's medical studies documented that with the right amount of testosterone, the systolic function of the effort of the heart remains stable throughout your life. So a strong heart is a good heart. It's really the way we study medicine here in the States. It's very traditional medicine. Um, it's it's very old-fashioned the way that we still learn medicine. We don't believe in prescribing natural medications. You know, I remember even in medical school, there used to be pharmaceutical companies that used to come and buy us lunch and treat us in certain things. It's a different mentality, but slowly and surely we're learning from other countries that do use more alternative, preventative, and wellness therapy of how to utilize that. I took the last 10 years of my life just to be able to learn the preventive and the alternative type of medicine. So I think slowly but surely you're going to see more and more doctors heading that way. Okay. The way that we replace hormones, you have really two decisions. First, are you going to replace hormones or not? If you are going to replace hormones, you do a blood test to see how deficient you are, and that aids you on how many milligrams or the dosage of the proper hormones to give the patient. We use what's called bioidentical hormones, which is natural hormones that are made specifically for the patient from plants. Bio means biological, so they're made from plants, and identical, they're referring to the chemical structure. If you remember from your chemistry class, the chemical structure is the most basic structure of the medication, and that's made through a compounding pharmacy to make it look identical to yours. So by doing that, it is a more natural way to replace, and it is a much safer with less side effects as compared to the synthetic hormones. Traditional old-fashioned way to replace hormone, it used to be called, or it is called Premarin. It's a hormone that it was made in 1920s. It's still being made. It's made from a pregnant horse's urine. And as you can see, this is not a natural form of hormone. It's been documented for the last 20 years that using this synthetic hormone, there is more likelihood for a woman to get cancer of the breast, cancer of the ovaries, blood clots in the legs, blood clots in the lungs. There's a lot of side effects, but yet there's still millions of prescriptions written for the synthetic medications. And that's why now there is an alternative using the biological identical hormones, which really has been used since 1930s in Europe. There are different forms of replacing hormones. There are patches, there are pills, there's creams. We use a technique called sotto-pelle technique, which is Italian for underneath the skin. And basically, anytime you're trying to replace anything in your body, you want it to make it physiological, meaning that you want to mimic your own body's way of using the hormones. And by that meaning, your estrogen and testosterone, you have it in your body 24 hours a day. You have it at a certain level. You need a little bit more, it takes it. You don't, it does not take it, but it's constant throughout the body. The only way you can mimic that is using pellets. The pellets are the size of a grain of rice or about half of a Tic Tac, and that medicine is placed surgically underneath the skin into the fat. Therefore, it's kind of like a slow release. It gives you a constant, but if you need more hormones for energy, to have relations with your husband, and that kind of activity, it will take a little bit more from the pellet. So it really works with your own body and mimics the way that your body normally takes the hormones. Yes, the process of replacing the hormones, I mentioned it was surgical, but it's a very simple technique. We use the gluteus or the butt area because most people have a little bit more fat in there. We'll make, after we give anesthesia, we normally use lidocaine, the same anesthesia that the dentist uses. It numbs up the area. That's all you're going to feel. We make a 2 millimeter incision, which is 2 millimeters, quite small with a scalpel. And then we use an instrument to be able to go underneath the skin into the fat to place the pellets in. We remove it, and then we put a Steri-Strip, which is a little piece of tape. The incision is too small to even use a suture, so you use a little piece of tape, and then the procedure is done. The benefit of that is the first time it lasts 3 months, treatments, and the second time is every 6 months. So it's not something that you have to do this frequently. I would like him to come see me more, but really it's every 6 months once we get the treatment going. There is a capsule that you have to take, which is progesterone. Progesterone, as normally you have to cycle the progesterone, which is what's the natural way to do progesterone, and you take it 12 days out of the month. But that is also a bioidentical hormone. The changes I've seen in my patient has been the most rewarding part of our job. Anything from literally preventing breakup of marriages the relationship with the kids, at work. You could tell when the husband and the wife comes here and we're treating the wife, the stress between them, but after getting on the hormones, the whole relationship really changed. Because if you think about what the hormones actually do inside the body and where the receptors, which are mainly anywhere from the skin to the brain, heart, and bones, and really other parts of the body, you're able to understand the differences that it does make. It is different for everyone. You know, it's for some people, you know, having no sexual appetite really bothers them for both partners, and that's the case with testosterone. That will change it around literally within days. The mucosa, including the vaginal mucosa, the skin elasticity, that changes the chemistry back to normal. So now you don't have urinary tract infections, yeast infections. It is not painful doing sex. That is all hormonal in effect. And most importantly, a lot of the effects is in the brain, including hot flashes. People cannot sleep. You can imagine getting 10 hot flashes while you're trying to get some sleep. You know, that particular individual, by the time they wake up lousy, tired, and they're cranky for the remainder of the day. Anxiety, depression, I mean, all those are not only problems that affect not only the patient, but everyone around the family in the workplace. And those are also the same people that are on a lot of medications, anti-anxiety medications, like Xanax, Valium, they're on Prozac, things that after being on treatment, most of them are able to actually stop taking, which is pretty exciting. Exactly, and that's what the traditional doctors think is, okay, if they have anxiety, let's just give an anti-anxiety medication. The way that wellness doctors think is, well, you have anxiety because I know your estrogen is very low. Let me now replace the estrogen. I don't have to give any other chemical that has a lot of other side effects and would mask any of the other symptoms. So you're absolutely right. What we provide is educational complementary classes to the community. As you mentioned at the beginning of the show, a lot of people do not know that this exists. Almost daily, we have patients that literally cry in our exam rooms because they're really so upset that their primary care never told them, you know, regarding this type of hormones, and that they had to suffer, you know, all the symptoms for really months to years. So we do have on a twice a month, we have complimentary seminars, and we'll give them presentation of the basics, what is hormones, is this for you, and then we'll give an opportunity to check the blood test to be able to see if they are a good candidate for this. I think the one main group of people that are not good candidates is if you currently have any type of cancer. I mean, you know, something that is acute, something that you want to treat right away. Otherwise, you know, if you have any other medical problems, if you have blood pressure, diabetes, if you're overweight, skinny, all those can be managed using the hormones. But if you have anything acute, which means something that you've got in the last 3 to 6 months, that has to be managed, you know, in the traditional way. But besides that, we could treat almost anyone.